Well, welcome back to Afternoons on 11. We are talking remedy for burnout with Dr. Starla Fitch, and we were talking about the 4 C's. We didn't get to the last one, which is connections, which you were talking about is so important to your health.
Connection is incredibly important. As we mentioned, it's more important than smoking, high blood pressure, and obesity. And Melanie, you'll never believe this, but in 1984, when people were asked how many best friends do you have that could help you or you could call them in an emergency, the answer in 1984 was 3. We all had 3 best friends. In 2005, we had 1 best friend.
Wow.
And now, 25% of people do not have anyone they could call.
Wow.
And this really impacts on all of us. We're just becoming less and less connected.
We're more connected with social media, but less connected personally, right?
Yes, exactly right.
And you're an ophthalmologist.
I am.
And this kind of all came about because you were, I can only imagine in your profession, how stressful, how easy it is to get burnout. And you experienced this for yourself. Talk about your own experience with burnout.
I'd be glad to, and that's part of the problem with doctors being burned out is there's such a stigma attached. We are can-do people. We in medical school they say, do one, see one, do one, teach one. So you're just supposed to know how to do everything, and that's not always the case. When I first decided to be a doctor, I was working for the Virginia Center on Aging, going into elderly homes, interviewing them about their needs assessment because I was a sociologist. I got a master's in sociology, and I just loved that, and I loved working with the elderly and decided to go into medicine. And after I'd been through medical school and residency and fellowship, after several years, I realized that I was doing more paperwork than patient work. I was being challenged on patients who had cancer of the eyelid, and the insurance company was saying, wait, this seems like it's cosmetic. And I said, what part of the word cancer don't you understand? So I just became very disillusioned, and I knew I wanted to be back that girl back in Virginia who had loved what I was doing and loved working with people. So I decided that I really needed to, and I saw changes all around my hospitals that I was working in. I'm in a large group practice, Eye Consultants of Atlanta, in Atlanta, Georgia. So I realized that I had to figure out what to do for myself to help others.
Yeah, what have you, and you've done, because I didn't realize the suicide rate with physicians, especially female physicians, very quickly, just talk about what you advise to doctors and physicians.
Absolutely, yeah, there's 300 suicides by physicians in the U.S. every year, and it's more in Australia, like 400. But things that doctors can do is, number one, recognize that there's a problem. What worked for me is doing coaching. In the business world, people have coaches all the time at the large corporations. Once you're in a certain managerial level, you get a coach. That's very unusual in medicine, but it should be much more common. Now I'm doing coaching for doctors and nurses to try and help them going into hospitals and large medical corporations to help them recognize the signs of burnout, to work together as a team.
All right, and again, the book is Remedy for Burnout,
Yes.
and you can find out more about this on our website, KPLR11.com. Thank you so much
Thank
for
you, Melanie.
sharing this with us today.
Absolutely.
Such an informational book and helps so many of our viewers, so thank you again.
Thank you very much.
And we come back turning the chaos in your life to calm. We talk it over with life coach Jill Farmer. That's next.